The height, weight, and vital signs have been checked prior to me entering the room.
Come in.
Hi, my name is Valerie. I'm a student nurse from TSC, and today we are going to be conducting a head-to-toe assessment, if that's okay with you.
Yes.
Okay. Can I have your name and date of birth?
Esmeralda Soto, December 11th, 1999.
Okay. And would you like for me to continue in English or Spanish?
English.
How are you doing, Ms. Soto?
I'm good.
Okay. And would you like to go to the restroom before we get started?
No.
Okay. Before I get to the physical part of the assessment, I'm going to ask you a couple of questions. Starting with, do you take any medications?
No.
Do you suffer from any allergies?
No.
Do you suffer from any chronic illnesses, hypertension, heart failure, diabetes? What about family history of any chronic disease?
No.
Okay. Have you had any surgeries recently?
No.
Where do you work?
I'm a student.
You're a student, so you're not exposed to any chemicals or radiation?
No.
Okay. These clothes. Do you eat a healthy diet?
Yeah, pretty much.
Your stress levels are
good.
You're okay? Okay. So at this point I would make sure that my patient is alone. And do you suffer from any mental, physical, or emotional abuse?
No.
Do you feel threatened by anybody around you? No. Okay, so I am going to get started on the physical part of the assessment. So I am going to be checking your scalp. I am just checking the overall hygiene to see if there's any lacerations, bumps, lumps, anything unusual. Do you suffer from dizziness or migraines?
No.
Frequent headaches?
Nope.
Any pain or tenderness while I was palpating? Okay. So I am going to change my gloves, and I am going to be assessing your temporal pulse. Okay, so I'm just going to be holding back here. Okay, it is strong bilaterally. Can you go ahead and look up for me? Do you feel any pain or tenderness?
No.
No. Go ahead and look up. Okay, this conjunctiva is pink and your sclera is nice and white. I am going to dim the lights and take my pen light. I am just going to be seeing the reaction of the pupil. So go ahead and look at the wall behind me. Okay. So your pupils were around reactive to light. Go ahead and keep looking at the wall behind me. I am going to be, now look at my pen, and just follow my pen without moving your head. Okay, good. Do you wear any glasses?
Yes.
Yes, are you farsighted or nearsighted?
Nearsighted.
Okay, and you don't feel dizzy right now without them?
No.
Okay, so I am going to ask you to look up for me. I am just going to be checking your nostrils. The nose does look symmetrical to the rest of your face. And I'm just checking to see if there is any polyps, occlusions. Do you have any trouble breathing? Any unusual drainage?
No.
Frequent bleeds?
No.
Okay, so moving down to your lips, I do see that they are nice and pink and hydrated. Can you stick out your tongue for me? Okay, there is no thrush. Can you wiggle it side to side? Okay, and with my tongue blade, I am going to tongue blade implant pen light. I'm going to be checking the inner, your buccal, all your gums around. Okay, I don't notice any cracked teeth or missing teeth. Can you say Okay, your uvula did rise. So can you just lift up your tongue for me one more time? Okay, and I'm just seeing if there's any sores down there or bumps, which you don't, so that's a good sign. Can you squeeze your eyes for me real tight? Open them up. Puff out your cheeks. Smile. Frown. Okay, good. And we're just checking your nerves here. Cranial nerves. Can you open and close your mouth? Okay, there's no clicking or grating of the temporomandibular joint. So I am going to ask you to close your eyes for me, and I'm going to pass you some cotton swabs, and you're just going to point to wherever you feel the cotton. Okay, good. Next is a smelling test with your eyes closed. You're just going to tell me what you smell. So go ahead and close your eyes.
Alcohol?
Yes. Okay, and there's another test which it also requires you to have your eyes closed.
Mhm.
So this one you're gonna feel either a sharp end or a dull end, and just tell me what you feel.
Sharp. Dull. Sharp. Dull. Dull. Sharp.
Okay, good. Now I'm gonna ask you to occlude one side of your nostril, breathe in and out for me, and other side. Okay, your nose is nice and patent. I am going to be checking your characteristics of your ears here. Skin integrity is intact. Do you have any pain or tenderness?
No.
I didn't notice any drainage. Have you had trouble hearing or ringing to the ears?
No.
Go ahead and cover one ear. I'm going to whisper 2 words and tell me what I think.
Pink pillow.
Other side?
Yellow foam.
Yes. Okay. So moving on, I am going to be palpating your lymph nodes. Just let me know if you feel any pain or tenderness. Do you have any pain or tenderness?
No.
Post-auricular, occipital lymph nodes. Your submandibular, sublingual, and submental. I haven't noticed any swollen lymph nodes. Do you have any pain?
No.
Down the jugular chain into the supraclavicular lymph nodes. No pain or tenderness there. There was no swelling, so that's a good sign. Can you go ahead and look up for me? I'm just seeing your trachea here. Okay, do you have any pain or trouble swallowing around this area?
No.
I didn't notice any goiters there. I'm going to ask you to turn to your left for me, and I'm just checking your jugular vein, not to be distended. Okay, I'm going to be feeling for the carotid artery. Okay, and it is strong. I'm also going to be auscultating your carotid with the bill of my stethoscope. Take a deep breath in and out and hold. Okay, and other side. Breathe in and out and hold. Okay, good. There is no bruise. I'm going to ask you to now perform a couple range of motions to the neck. So look left and right, and then up and down. Okay, and now with resistance. Good, good. Shrug your shoulders for me. Down, shrug your shoulders again. Good. Have you noticed any pain or tenderness to your upper extremities?
No.
Any weaknesses?
No.
I'm going to be checking your pulses up here. So we have the brachial, and we have the ulnar and the radial pulse, which are all strong bilaterally. Can you go ahead and extend your arms, flex them up for me, push against my hands, hold against my hands. Okay, can you go ahead and show me your hands? I'm just checking capillary refills here, which are all less than 2 seconds. Go ahead and spread your fingers apart, close them, fist, open. You don't have any pain or tenderness here? Okay, I'm just going to be feeling for any lumps here or bumps. Okay, there was none. So moving on to your chest, I'm going to be checking your skin trigger here before we do anything else. Okay, so if you can turn around for me, I am going to start with the posterior side of your thorax, and I am just seeing your back. I am going to be palpating and auscultating. Have you had any trouble or labored breathing lately that you've noticed? Okay. Do you have any pain or tenderness here?
No.
Okay, so I am going to be auscultating your lung sounds. So if you can give yourself a big hug and just breathe normal. Okay, I am going to be checking your lung expansion here. So you can take a deep breath for me in and out. Okay, and I am going to be palpating your kidney. So let me know if you feel any pain or tenderness.
No. No.
No? Okay, you can go ahead and turn to your side. Okay, and lift up your arm for me. I am going to be checking to see if there is any bulging or retraction of the intercostal spaces. Did you feel any pain or tenderness here?
No.
Okay. Go ahead and take a deep breath in and out. And another one. Good. Oh, okay. Other side, please. The right side. Okay, pick up your arm for me, and I am doing the same thing. I am just checking to see if there's any bulging or retraction of the intercostal spaces. Do you have any pain or tenderness?
No.
Okay, and I am going to be auscultating. Okay, take a deep breath in and out. In and out. In and out. Okay. Go ahead and face the wall and to the front, please. Your interior thorax, I am just going to be seeing. I don't notice that you're using any accessory muscles here either. So I'm going to be palpating. If at any moment you feel pain, tenderness, or discomfort, let me know. No pain or tenderness?
No.
Okay, so I am going to be auscultating. Okay. In and out. Okay, and you did say you don't suffer from any heart problems, right?
No.
Have you felt any tightness to your chest or anything like that? No? No palpitations?
No.
Okay, so I am going to be auscultating your point of maximal impulse for a minute, or your mitral, so. So the fifth intercostal space, midclavicular, for a complete minute here in the mitral. Now we're going to go to the aortic valve. Next to your pulmonic, Erb's point, tricuspid, and one more time to the mitral. Okay. And I didn't hear any dysrhythmias or murmurs. I would also check it with the bell of my stethoscope to see if there's any murmurs. So moving on, I am going to ask you to lie down for me. Okay. And here I am going to be checking your abdomen. So if you could just raise your shirt for me. Okay. And I am seeing that you have a nice and flat belly here. I don't see no distension, no pulsating. So I'm going to go ahead and auscultate your bowel sounds. Have you experienced any constipation, diarrhea, anything like that?
Nope.
Okay. I'm listening 15 to 20 seconds. Okay, your bowel sounds are present, and if they weren't, I would be auscultating for a total of 5 minutes in each quadrant. I am also going to be auscultating your abdominal aorta here. Okay. And now I am going to be percussing. Okay, and let me know if you feel any pain or tenderness.
No.
No? I'm going to be pressing down on your bladder. You might feel the urge to void. Do you have any pain or tenderness there? No? Have you had trouble going to the restroom, going to pee?
No.
No? Have you noticed any unusual bleeding out of your menstrual periods? No? So I am going to place you in a dorsal recumbent position. I am going to go ahead and perform hand hygiene and glove. So I'm going to go ahead and glove. With my non-dominant hand, I am going to spread the labia majora, and I'm going to be seeing if there is any lacerations, any scars. I'm going to see your overall hygiene here. If there's any discharge, I'm going to go ahead and get a culture. Okay, so I am going to ask you to turn to your side now. We are done. And okay, and the same thing. I'm going to perform hand hygiene. Replace my gloves. With my non-dominant hand, I want to separate the buttocks, and I am looking to see for the same things: any redness, inflamed, lacerations, scars, hemorrhoids, any unusual bleeding back here, which I don't see any. So you can go ahead and turn around. Thank you. And again, I am going to perform hand hygiene and glove again. Have you noticed any weakness to your lower extremities?
No.
Pain in your hips?
No.
Do you have any pain or tenderness down here?
No.
No? Okay, so I am going to be checking the femoral pulse, your popliteal pulse, the tibial pulse, and last your dorsal pedalis pulse. I'm also going to be checking if there's any pitting edema, your capillary refills here. Okay, and now I am going to be performing some range of motion. Let me know if you have any pain or tenderness.
No.
Okay. Abduction, adduction, dorsiflexion, plantar flexion, inversion, eversion, your toes, abduction, adduction, dorsiflexion, plantar flexion, inversion, eversion. Okay, and just in. No pain here?
Nope.
Okay, can you push against my hands? Good. Other side, inside, and towards the middle. Good job. Okay, now if you can stand up. Okay, we are going to be performing the get up and go test. So this test is just going to require you to get up with no assistance of anything around you. You're going to walk 10 feet and then come back and sit down with no assistance.
Okay.
Okay, so go ahead and go this way. Pretend it's 10 feet, turn around. And go ahead and sit down. Okay, so you did that with ease. One more time, you're going to stand up for me. This is going to be the Romberg's test, which requires you to close your eyes. And we are looking here to see if there is any swaying, which there is none. So that is the reaction we want. Go ahead and open your eyes. And since I do have you standing, I'm just checking to see if you have any signs of lordosis or kyphosis. Can you go ahead and turn around? I'm just going to check your spine, touch your toes. And do you have any pain or tenderness here?
No.
It does seem pretty aligned. No signs of scoliosis. You can stand up. How are you doing?
Good.
Feeling dizzy or anything?
No.
Okay, you can go ahead and sit down. So this does conclude the head to toe assessment with me.
Okay.
So do you have any questions for me?
No.
No? Okay, so then I am going to leave you your call bell here, and if you have any questions or need help with anything, you can go ahead and give us a call.
Awesome. Thank you.
Thank you.